Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Hello, we are excited to be back and continue talking more about a little part 2, potentially part 3 coming from our last episode where we did an overview of just the pelvic rehab fertility specialist certification that we did. And we're going to kind of break down a little bit more about each one of those sections. And so we thought we'd start tonight with the endocrine system and nutrition, if we can get that in kind of together. But before we start, we will start with our Tell Me Something Good. Roxy, since we spoke last, tell me something good.
Well, it's been kind of wild here at our house. My husband's out of town and
oh, yes. Tell him where he is.
he is in the great continent of Africa. He actually sent us pictures this morning. Well, right now he's sleeping. It's just like a whole, we're backwards basically. But he went on a safari yesterday. So we woke up to some really fun pictures of crocodiles and giraffes and elephants and
that's awesome.
Cheetah and water buffalo and all that. That's like the Lion King, but not.
That's so cool. But not.
So that was fun.
That's awesome.
Fun to be able to just kind of look through that. And the girls were I didn't really know what was going on, but I was so pumped about it. And there were some fun pictures. There were like all these mama elephants with babies that were walking around. And, now you can do like live pictures. So you could kind of and so anyway, that was fun. That was a fun thing from today.
That's awesome. Okay. Let's see. Mine is today is my husband, Nathan and I's 19th wedding anniversary. So,
whoop, whoop.
Yep. Little 19 years. Actually, it's been like 25 years because you add on the 6 from before we got married. That's crazy. Whew. How did we get here? Anyway, if we're being really transparent and authentic here, Roxy and I actually recorded last night, and we recorded an episode on the endocrine system. And when we were done, we both felt overwhelmed and tired from it. And we decided that it was too much.
This is take 2, everybody.
This is take 2, because we're just going to try to kind of glaze over it, because it was just, whoo, man.
Oh, man.
If anybody has any questions, we'll just, send them to us directly. But otherwise,
we'll just tell you you're welcome.
Yeah. We are not endocrinologists, so we don't claim to be. And there are some really amazing endocrinologists out there, so we're going to let them do that job. But we just kind of wanted to share like why we care and why we need to know about this stuff, because I think when somebody hears endocrine system, it's kind of like, what does that mean? And basically, that's our hormones. Like, we have endocrine glands all over our body and endocrine tissue, and they secrete hormones. And so that's when we're talking about estrogen and progesterone and that sort of thing. That is our endocrine system. So if you didn't know that, now you know, and you don't need to be afraid of it.
Yeah, don't shut down when you hear that word. You learn something new every day. And we want to just dive a little bit into this, not as much as we could.
Yeah.
But just to even, just thinking about some generalizations that get made about hormones. We want to bring a little bit of light to it, because it's more than emotional middle school girls and hormone raged men.
Yeah. So, I think in a gist, we kind of can have an overview of the certain areas that we kind of focused in on, especially in this course. So one of them being the HPO axis, which is the hypothalamus pituitary ovarian axis. And so it's important for us to know, as providers that are treating this population, that we have, from the hypothalamus, there's a hormone released And that hormone is going to go down to the pituitary, which then the pituitary is going to release LH and FSH, and then that's going to go to the ovaries. And then from there, the ovaries we're going to have ovulation, or we would want to have ovulation. And then from there, when we have ovulation, we have the corpus luteum, which when that's left over, that makes progesterone, and the follicle makes estrogen. So you can see where if we're getting somebody's lab values or we're helping a patient and they show us their lab values and we see where there can be some discrepancies or some numbers aren't looking correctly, it with us having that knowledge, we're able to kind of cue in and have an idea of what could be going on where, and just be a good resource to then refer back to providers and just be able to have a conversation that we're educated in and that we know what's going on. So we're not like, I don't know. But you can imagine, from that, we think, okay, well, what's the main diagnosis that we see that affects the ovaries? And that would be PCOS. And again, I mean, we could go in depth with that too, but it's important for us to also recognize that if we have somebody coming in that shows us lab values, for us to be able to kind of understand what are we looking for, like what indicators in those labs can we be able to identify, well, this person might have PCOS before we even, have any further discussion. Or someone's like, yes, I have PCOS. And so that can give us a good reminder of like, okay, they might be insulin resistant. We could have high testosterone, all that kind of stuff. And knowing that, like high insulin, high testosterone, that could lead to no ovulation, which could lead to infertility. So as we are learning all of this, it just helps us better serve this population.
Yeah, I mean, I just think too, a lot of times people in not just the fertility space, but especially the fertility space, or just like any
Yeah.
kind of like with, for example, PCOS, those like sometimes we're getting those people and we might get a girl who just is struggling with PCOS, the symptoms of it, and she's not really like trying to have a baby right then. She might not even be, like in that headspace, but we're helping her be healthy, and so we're wanting to look ahead at that even and manage that. But I guess what I'm trying to say is this process is really complex. And, one provider is going to take a look at this person, see what they can do for this person, or maybe they can't do for this person, send them to the next person. Then that person kind of does the same thing. And I think what I've kind of found in just working with complex patients, but then even now getting into the fertility patients too, is that we have the advantage of being able to spend time with these people. We get a whole hour with them. Megan and I both, at least we have an hour with each patient. And man, I can't tell you sometimes some of the basic, just educational things I've been able to share with patients and just even help them get their head on straight and say, look, I think let me give a little bit more to maybe what that provider was saying. If they come back frustrated from like a specialist that they've been waiting 2 or 3 months to get into, and then it is maybe a dead end. And so anyway, I just think like Megan just gave a really good overview of why we care. And someone could say, well, cool, like just why don't you just let the endocrinologist deal with that, Well, some people are only seeing the endocrinologist like every 3 months, 6 months, like not, and even then it might be a 20, 30-minute conversation, if that. And so sometimes I just think like for us to be able to have the knowledge, the foundational knowledge of it, we can bring a lot more to the table and help them just understand and go through the weeds. Or maybe like Megan was saying, if they have PCOS, and they're insulin resistant, and no one suggested them go see a nutritionist or a dietitian, or like just we can bring in more options. We can maybe hopefully just bring up more perspective to the table, because we, like Megan said, we are not endocrinologists. We aren't going to pretend to be endocrinologists, but to just have an understanding only helps our patients. That's really what we're trying to achieve, just even in this conversation, is to say, look, this is important. We don't have to know everything. We need to know some. This is why, this is why it's important for just you as a person walking
Yeah.
around, to even kind of understand this for yourself.
Yeah. Cause I mean, things get missed and, we're just another set of eyes on all of this. And the way I look about it, like if we're treating an ortho patient and they go to the orthopedic doctor and they communicate back with the PT and say, okay, they've got tendonitis or tendinopathy or whatever. I mean, we are going to understand what goes into tendonitis or tendinopathy. We have an understanding there. Or if they have a certain injury, like we have an understanding about what the process is going to look like to get them back to where they need to be. And so it's the same thing, except on the hormone side of it. If you go to see your endocrinologist and we find out some information or we have labs drawn, it's our responsibility, if we're going to be working with you, that we have a basic understanding of at least the basic hormones and what could be happening. Because I just find it so fascinating. Really, I really kind of put two and two together as far as like the corpus luteum making progesterone, follicle, estrogen. And if we're not ovulating, guess what? Those things aren't happening. Okay. So now we potentially could be like, if we're not having correct progesterone levels, like, are we going to end up having these like heavier periods? And I just think it's so interesting to you pick up on little things when patients say stuff and just kind of like, huh, okay, I'm going to like put that down and we're going to circle back to it once we get all the pieces. And yeah, it's just really interesting stuff. And then the other thing too with the endocrine lecture is understanding kind of thyroid function and what we need to be looking for with those lab values and how that works and how the thyroid is kind of this furnace and the thermostat is the pituitary gland, and how if the thyroid is, which is like T3, T4, if that's too kind of hot, if you will, if that's high, then the thermostat's going to want to turn it down. So you're going to have this TSH that starts to go down. And so just knowing how those work together, and that if your TSH is high, then, like, let's say it's above 4.5, you'd be considered in this like hypothyroidism. And if it's low, you're considered in hyperthyroidism, which can seem opposite to people. It can get very confusing. And being able to identify or help people understand, well, this is why you're feeling the way that you are, or we're listening to symptoms and they haven't been checked yet. It's like, it can definitely cues us off. Have you had your thyroid checked? Have you had a full panel? Have you had antibodies checked? Because you get an autoimmune diagnosis of Hashimoto's that can definitely affect and change fertility. So basically with that, without going into the weeds like we did last night, I think it's just knowing, at least if you're, there are a lot of great therapists that are out that we look to as our mentors that know a lot about hormones. It can be an extra little piece that is very helpful, especially when you're seeing somebody for fertility support or optimization. So, Roxy, anything else with endocrine before we move on to nutrition?
I would just kind of even put a bug into anyone's ear that's just like looking for providers. There's a lot of different programs out there to help with like fertility. And a lot of them are really isolated to just manual therapy and just PTs that kind of have a protocol or a cookie cutter, and maybe not even just PTs, like chiropractor, whatever kind of body type ortho
body worker.
Yeah. And it's a really like isolated approach of just, let's just get our hands on these people and stay in our lane and just do what we do and only do that. And I think just what my eyes have really been open to, just learning more, like learning this fertility stuff, is that, man, that just is a really big disservice to someone, the patient that's in front of us, to not have this holistic understanding of what they're going through, and to be, like Megan said, another set of eyes on them. So not going to discredit necessarily anyone's skills, anyone's knowledge, anyone else on that by any means. Like there's a lot of good people out there that are doing, but just that would just be something I would look for in, if you're looking for some manual type of help with fertility. Yeah. So maybe someone who understands the bigger picture.
Right. Because I think we've talked about this, but if you're not ovulating, if there is something happening at the hormonal level and you're not ovulating, I could mobilize your ovaries all day long. But if you're not ovulating,
you will never get pregnant if you're not ovulating.
You have to ovulate. So which we're going to do a whole nother episode on menstrual cycle and tracking. But that's why we need somebody to also, when they come in, we're going to be asking you to track and to show you how if you don't know how. And if we really need to bring in more support, we have resources for people that's what they do. Like we have somebody locally here that I love chatting with, and well, multiple people, and that's like the FAM method. And then we also have, at least in my area, some good instructors that teach like the Creighton method, that sort of thing. And even if you just generally, like when I was taught how to track, it was after I had kids. And it was, I mean, I wanted to get off the pill, and I wanted to make sure that I understood my body. And I personally am not Catholic, but I went, and it was at a Catholic church, and was taught how to track my cycles. Pretty sure it was the Creighton method. And I learned a ton. I learned so much about my body that I was like, oh, wow, why didn't I get taught this sooner? Um, cervical mucus and all that stuff. And I think we hear that word, and we're like, ugh, I don't want to talk about that. But I know when I was younger, I was just like annoyed by it all. But now you see this change happen throughout your cycle, and it's such a beautiful thing. And you just realize how much factors outside of your body, like stress and things like that, can affect your cycle, and how it can affect your fertility, and how it is really amazing how the body will shut down the reproductive system first, basically, when it is in a high stress situation, because it's going to try and it needs to survive. But in order to do that, it's going to shut down that reproductive system first. So yeah, I think that was like my biggest thing I've loved so much about Dr. Yini's course is she has been through all of the different fertility trainings that are out there that are hands-on approach. So there are so many different visceral courses and different programs, and she has learned and really put this all together, and to be able to say, this is what I've seen work, and now to be teaching this is so exciting. And to know that, like, okay, to me, this is like, okay, top of the line.
Okay, we're going to switch gears now. We're going to talk about nutrition and fertility. And if I don't know what episode, could we talk to Kate?
Yeah,
whatever episode,
Morgan.
look back, Kate Morgan. We talked to her. We are going to be wanting to bring her back on. She has just a wealth of knowledge about, and she really specializes in the fertility space, and obviously is a dietitian, the nutritional aspects of the fertility world. And so we're going to just give our knowledge on this.
Little overview.
Not as dietitians, but just
yes,
what we know and what is evidence-based, and what is appropriate for us to really discuss with you and help you help yourself be better.
Yeah. Again, because when you're working in, as Roxy and I have, the way that we treat in our clinics is, again, more of this root cause holistic approach. And we need to understand and recognize and have an appreciation for the fact that if we have some unexplained infertility, I mean, goodness sakes, even if we don't, but where I'm going with this is there's most often this underlying inflammatory response happening in the body. And we need to be able to understand that and understand the impact that nutrition and what we're putting into our body can influence inflammation. And if we're not addressing that, again, for these patients coming in, again, I really do feel like we're doing a disservice, because if we're coming in and you're doing all this work with fertility and working with a reproductive endocrinologist, and we're going and having all this processed food and different things that isn't serving our body well, we could be missing a huge piece. Sometimes it's just, it doesn't take too much. Just clean up your diet a little bit and start slow. Like, you don't have to do a big overhaul, and it's not a huge elimination. But really, from what we were taught in this course and kind of just knowledge that we kind of knew before, if we're wanting to kind of keep it simple and not overwhelm anybody, it has been found that kind of a Mediterranean type diet is really where it's at when we're talking fertility, because it is so anti-inflammatory. And there can be significant improvements seen in pregnancy rate, live birth rates, and sperm quality. So it would be like you and your partner, we'd be recommending this. And this is just like 80% of the time. You don't even have to be perfect, which is fabulous because who's perfect, you know?
True. Well, and I just think about how low hanging fruit this is.
Yes.
You have to, we're eating anyway. Like we're not
Yes.
telling you to do anything above and beyond, or, you know what I mean? It's not procedure. It's
Yeah.
not going to see like some specialist and do all these, like, I mean, the
Yeah.
labs are easy anyway, but just like this is just low hanging fruit that is easy and
Yeah.
you're eating anyway. Let's just change just a little bit here and it can make huge differences.
I know. Well, that's such a good point, Roxy. I mean, you're eating anyway. Even if you don't go and see necessarily a dietitian or somebody, but you're listening to this and you're like, oh, I mean, goodness sakes, there you go. Some free advice. Like go, you could you could easily look up Mediterranean type diet and see, but really we're looking for, we want to have like fresh fruits and vegetables, whole grains, nuts, legumes, good healthy sources of fat, those sorts of things, fish and poultry. Like it actually is a really awesome way to eat. It's just you're eating very clean.
Yeah, it's like the more natural or the more like real food, the better. Like just go to the
Yeah.
produce aisle
Yeah.
and
Shop
get
the
some
outside of the
produce.
grocery store, people. Outside of the grocery store. It's the perimeter. That's where we're gonna go. So basically when we're looking at diet changes, we really are wanting to try to help balance blood sugars. And when we're looking at blood sugars and fertility, those sorts of things, like again, what we mentioned with the endocrine system, but when we're looking at like particularly like PCOS, which is the most common cause of anovulatory infertility, which means no ovulation. So 70% of women with PCOS are insulin resistant. When we have this insulin resistance, we have this higher blood sugar, and this higher blood sugar that we have increases insulin production. So then this increased insulin production increases testosterone production in the ovaries. And then we have this increased testosterone, which blocks ovulation. And then no ovulation causes no pregnancy. So you can see how that goes down. But in that too, with our knowledge that we have now of the endocrine system, that can be very helpful for us as the PTs working with you, PTs or OTs or, whoever's going through this training to know how that's all working. So then we can help with guiding you again on how to improve this.
So then when we're looking at some of these dietary changes and recommendations and what people are doing there's some common mistakes that people aren't realizing are actually could be, let's just say could be inhibiting their fertility outcomes. And so one big one is not eating enough or like fasting or skipping meals. Basically, when we don't eat, then our body goes into like this survival mode. And Megan hinted at this earlier of, even high stress. If we're in that survival mode, then our body's going to shut down the reproductive system right away. And so if our body thinks that there's a famine because we're skipping meals, then it's not going to say, ooh, this is a great time to have a baby. So it's going to shut down all this work that we've been working to try and get like ovulation and, this really good cycle going. But if your body doesn't think that it's safe and that there's going to be enough nutrients for you and a baby, then it's just going to shut all that down. And so not eating enough food is a huge mistake, or fasting can be a huge mistake depending on your body type and kind of how your body responds to that lack of food and nutrients.
Yeah, because like Rossi just said, if your body is sensing this as it's unsafe, and then it potentially is causing the stress, which then potentially could cause like increased cortisol, that sort of thing, that release. And, when we talk about, I mean, you can look at all sorts of things with fasting and it can be appropriate for some people, but all we're saying is to be cautious if you're in the trying to get pregnant. Now, if you're in like the preconception phase, which if for whatever reason, if you are kind of working on insulin resistance and you're doing a little intermittent fasting, maybe that's what's good for you at the time. But if you are somebody who is trying to do these like really long fasts, and it's wearing you down and you're feeling drained and you're having brain fog and you're just feeling awful and you're trying to get pregnant, that's not the time to be doing that. Honestly, if you, let's say you eat dinner at 6 o'clock and you stop eating by 7, and then you don't eat again until the next day at, let's say, 8 or 9, then you've had a 14-hour fast and your gut has had that time to rest. So again, we're not experts in this area, and you could probably find resources and all saying all different things. But what we do know is basically we need to try to help the body feel safe and having the right energy and nutrients. And so we want to make sure that we're eating a diversity of fruits and vegetables. And if we're not eating enough of that or healthy fats, we're going to be lacking. And then also some other common mistakes is just like eating too many simple carbs like white bread, pasta, that sort of thing during the time that you're trying to conceive. Okay, so next we're going to talk about a few nutrients to consider. And again, this is why it's really great to also be working with a dietitian or a naturopathic doctor or somebody in the space that can test for these things and also give you additional counsel on what to take and how much to take of it. So the first one we're going to talk about is iron. And again, we are not telling anybody to go out and take these. Please do not. We are just telling you some of these nutrients to consider because they could be right for you.
Yeah, as they relate to fertility too.
So women who supplement with iron are less likely to struggle with ovulatory infertility. That's just, something, but it's just definitely something you'd want to get checked because you don't want to be taking iron if your levels are where they need to be. So, but it is one to be looking at. And I have had some patients where they are actually postpartum and just really struggling with fatigue and brain fog and not feeling like themselves. And just to be an advocate to push, because a lot of, I think, women, especially during that time, I know we're shifting out of fertility, but especially in that postpartum phase too, you just assume because you're tired, because you're taking care of a small baby, but it's important to get these things checked because, like, for sure enough, the situation I was in with my patient, I was like, let's get this checked. And she was very low. So anyway, iron. All right, Roxy, what's the next? We're going to ping pong.
Sure. Vitamin D is the next one. Just in general population that helps with bone health and immunity, but we want optimal levels for fertility because it gives us a higher embryo quality and then just improved pregnancy rates. And so basically something interesting is that like 40% of the population is deficient. I think some of that came from like skin cancer, if I remember right, like being afraid to like have skin cancer. So we covered up completely. And if you don't get outside and do stuff, then you don't get that vitamin D. So we like went from like this fear of skin cancer to now we're all vitamin D deficient. So just kind of fun fact there.
I mean, I will say, if you ask me what one of my favorite supplements is, vitamin D. So like, good old vitamin D3. If I'm ever sick, that's what Nathan says to me. Have you been taking your D3? Oh, or that or vitamin C. But man, you get that too much vitamin C going, I cannot leave the bathroom. So, oh man. We should have like a whole episode of just like terrible stories about our truth bombs. Yeah. I've got the
literally
funniest
truth bomb.
I literally have the funniest poop story. Maybe I'll save it for the end. Take a poll of who wants to hear it.
I would say, I don't know that anyone wants to hear my poop story. I don't know that I want to share my poop story. I don't know if I'm that comfortable yet sharing mine, but.
Well, I did not poop my pants.
I may or may not have pooped my pants. And I don't know if we need to cut that out.
Oh my gosh. Okay. Now everybody's going to really want to.
Oh my goodness. No one's going to hear anything else we say.
I know. They're going to be like, and we're done. All right. Well.
Anyway, back on the ranch.
That came to mind. Back to the ranch. That came to mind just because it's like sometimes some of these supplements, man, you get your body saturated where you need to be, and you will be going. So okay, B12. B12 is important because it is It supports brain and nervous system health, as well as genetic components of the egg and sperm. B12 is definitely something that if you're low in, it can affect your energy. So it's, again, another easy thing to have tested to see where you're at. And low levels can be associated with poor implantation, poor sperm quality, increased risk of miscarriage, that sort of thing. So it's, again, just another one to kind of have on the radar.
Okay, next is selenium. And this is a big player in our thyroid hormone. It converts inactive thyroid hormone T4 into the active form, which we need, which is T3. And that controls like the rate of activity in all of our cells. And so, anyway, that's something we really need. As far as then, if we have low selenium, then we're going to have lower thyroid function, and that then is associated with like irregular ovulation, infertility, recurrent miscarriages. Good levels of selenium then can increase your egg quality of the eggs that you have.
Yep. I would say all of these are my favorite. Selenium is a good one. And the last one we're going to talk about is magnesium. And if you come and see me as a patient, you will be tired of me talking about magnesium because most of us are deficient in it. And there's so many different forms of magnesium, but magnesium is definitely something that can be really important to consider as well. And magnesium it supports progesterone production, and therefore low levels may lead to first trimester. Well, we're looking at if you have low levels of progesterone, it could lead to first trimester miscarriage. So what we're saying is like keeping magnesium in mind of supplementing with it to help with that because it can support progesterone. You know, if you're somebody who you don't need to take progesterone, but you're like, I just want to support myself in this. And again, this would be like you're kind of talking to somebody who's looking at all your values. And the exact mechanism is unclear, but studies have shown infertile women have lower serum levels of magnesium. So again, if it's something that you've been struggling with infertility, magnesium, something to be looking at. Hopefully, the providers that you are working with are keeping all of this in mind and looking at these main nutrients and seeing where you're at with them. So, anything else interesting that you want to mention from this lecture? I really loved the food source of selenium was like a Brazil nuts, like you just need two. I remember Dr. Danielle was like, you just need two, which is kind of nice because I'm somebody who I have to take a lot of supplements. And sometimes you've heard me talk about that I go on supplement strikes and I don't want to take more pills. And so I was like, if I could eat two Brazil nuts and take selenium off of my list, I would do it.
Seriously. I just think that I know personally, I underestimate just the power of what I use for fuel for my body and the power of the different food sources, and whether it's through supplement or through Brazil nuts or whatever food source, we're getting all these like nutrients with, not just for fertility, but just for, we brought up, handful of these and commented on, the bullet points of them for the value of them for fertility, but the bullet points of the value of them for every other function in our body are also, there's like a bazillion of them for each one that we just listed. And there's a lot more that we didn't list, obviously. We just kind of hit some high points here. But I don't know. I think I just underestimate the power and the value of fueling my body. I think sometimes I'm just like, I just got to eat and move on with life. But actually just being intentional with that, really, that was, I don't know. Some people are a lot better than that. But I just sometimes underestimate how important that is and how we can really just like better our body in so many ways by just like putting good things in it.
Right. And I think it'll be fun too when we do have Kate back on here to have her dive into those a little bit more and give her knowledge about each one of them. And there's probably some others too that she would be putting on that list. And then also too, I think it'd be helpful for everybody to hear like even like her considerations for what she's looking at for a good prenatal vitamin, because there's so many that are out on the market. And just finding something that has like a high quality to it so that we're getting absorption and making sure that we're hitting all the needs that we have. And there are some different products out there now that are like prenatals basically for men too, which is awesome to be able to support their fertility as well, because let's not forget about them. All right. Well, that wraps up our little overview of the endocrine system and nutrition and why we care about it. And I mean, at the end of the day, this stuff is really cool. So we love learning about it. And if you guys have any questions or want to know more, please reach out. You can find us on Instagram at the Pelvis Project. We're still working on that website. We'll get that soon, sooner rather than later, hopefully. But you could always send us a direct message through our Instagram. But if you want to do us a solid and comment or rate the podcast on any of the listening platforms, that would be great. And we're looking forward to continuing this conversation in a couple weeks when we'll talk about menstrual cycle and tracking. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.